So needless to say, Dr. Khan was very pleased that he matriculated in our program, and counterwise, we were actually very pleased to have him because his internal medicine training really came to bear in taking care of many of the very sick patients that we see at the university hospital, which of course acts as a tertiary care center. So we get referred patients from two counties on Long Island. Suffolk County, where we're actually located, has about 2.5 million people, and Nassau County to the west of us has another 2.5 million people. So we basically have a catchment area of 5 million people. So as you can imagine, with that huge population base, we get some very sick people. Some of the patients who come to us in dermatology actually end up in the intensive care unit, end up on the burn unit, having major problems with their skin, and then indirectly with the rest of their body, because if you have incompetent skin over the whole surface area, then you have problems with fluid and electrolyte balance and blood pressure and congestive heart failure. And it was for these kinds of patients that Dr. Khan was particularly good in his care, because, as I said, he had already undergone the rigorous training for internal medicine. So during his training, the patients weren't enough. He was always attracted to doing research, so he actually came back in my laboratory for an extra year and devoted himself to some actually very interesting projects in tissue engineering, trying to understand first how wounds normally heal, why wounds don't heal in patients that have chronic ulcers, and finally helping us come up with a construct that we all hope in the very near future will actually promote healing in these patients with chronic non-healing ulcers. So he did that for a year, and then he went back into the clinic. He finished up working basically as a junior attending. He was clearly my right-hand person during the time. And then, if that wasn't enough training in aggregate, Dr. Khan decided he wanted to hone his surgical skills. And so he went off to a very prominent group in the U.S. to do surgical training. And so, as you can tell, Dr. Khan is a very accomplished clinician, clinical scientist, and surgeon. And I suppose the most significant thing I could say about his clinical care is that I would be most happy to be under his care, and I would be most happy for my family to be under his care. During his last year in the lab, he was actually an assistant professor and had himself gotten a Dermatology Foundation Award, which is a very prestigious award for junior clinical investigators here in the States. So Dr. Khan and I had a lot of fun doing research together. Also has his name on a couple of pending patents from our laboratory, and of course he hopes those are successful.